How to survive a heart attack. 7 life-saving tips that every senior must know. Picture this scenario. You're sitting quietly at home when suddenly you feel an unusual pressure in your chest. Your heart starts racing, not from excitement, but from fear. You're completely alone, and something feels terribly wrong. What would you do in those crucial first moments? Today, we're diving into 7 essential steps that could literally save your life if you ever face a heart attack while alone after 60. Every year, thousands of seniors experience heart attacks when no one else is around. The statistics are sobering, but here's what gives me hope. With the right knowledge and quick action, you can dramatically increase your chances of survival. These aren't complicated medical procedures or expensive equipment we're talking about. These are simple, practical steps that anyone can learn and execute when it matters most. By the end of this video, you'll have a clear action plan that could mean the difference between life and death. We'll cover everything from recognizing those subtle early warning signs that many people miss, to specific actions you can take to buy yourself precious time until help arrives. Some of these tips might surprise you, especially the last few that most people never think about but could be the most important of all. Have you or someone you love experienced a heart attack? We would love to hear your story. It helps others understand these things are real and should be taken seriously. Tell us about it in the comments below. Let's start with the foundation of survival, recognizing what's actually happening to your body before it's too late. The first critical step is understanding that heart attacks don't always announce themselves with dramatic, chest-clutching scenes like you see in movies. Real heart attacks, especially in people over 60, often begin much more quietly. Your body might be screaming for help, but in a whisper rather than a shout. What you're looking for is a deep, uncomfortable sensation in the center of your chest. Many people describe it as pressure, like someone is sitting on their chest, or a squeezing feeling as if their chest is slowly being filled with cement. This discomfort might come and go, which tricks many people into thinking it's nothing serious. But if it lasts more than a few minutes or keeps returning, don't ignore it. Heart attacks can also disguise themselves as other symptoms. You might experience shortness of breath, even while sitting still, as if you just climbed a flight of stairs. Some people feel pain radiating to their arm, shoulder, neck, or jaw. Others break out in a cold sweat, feel nauseous, or become lightheaded. For many seniors, especially women, the pain might feel more like pressure in the back or stomach rather than the classic chest pain. Consider Beverly, a 76-year-old woman who felt what she thought was severe heartburn after dinner. But then she noticed she couldn't catch her breath properly, and her palms became clammy. Something told her this wasn't normal indigestion. That intuition saved her life because she acted on it immediately instead of waiting to see if it would pass. Your body often gives you warning signs before the situation becomes critical. These early signals are your window of opportunity. Don't wait for the pain to become unbearable or for more obvious symptoms to develop. Trust your instincts. If something feels different or wrong, especially if you're experiencing a combination of these symptoms, take it seriously. The moment you suspect something might be wrong with your heart, your next action should be automatic. Call 911 immediately. Don't debate with yourself about whether you're overreacting. Don't wait to see if the symptoms improve. Don't try to drive yourself to the hospital. Make that call. Here's why this matters so much. Every minute counts during a heart attack. Your heart muscle is being starved of oxygen, and the longer this continues, the more permanent damage occurs. When you call emergency services, trained professionals begin preparing to save your life before they even reach you. They're bringing specialized equipment, medications, and the expertise to keep you alive if your condition worsens during transport. Attempting to drive yourself is one of the most dangerous decisions you can make during a heart attack. Your symptoms could intensify suddenly, causing you to lose consciousness or become unable to control the vehicle. This puts not only your life at risk, but also endangers other drivers and pedestrians. Think about what happened to James, a 68-year-old man who felt chest tightness while working in his garage. His first thought was to drive to the urgent care clinic down the street. Fortunately, his neighbor saw him struggling and convinced him to call for an ambulance instead. Halfway to the hospital, Robert's condition deteriorated rapidly, but the paramedics were ready with life-saving interventions that wouldn't have been available if he'd been behind the wheel. Emergency dispatchers are trained to handle these situations. They won't be annoyed if it turns out to be something less serious. They would much rather respond to a false alarm than miss the opportunity to save someone's life. Keep your phone easily accessible, especially if you live alone. Many smartphones have emergency features that can dial for help even when the phone is locked. Learn how to use these features before you need them. After calling for help, your next powerful action is surprisingly simple. Chew an aspirin slowly. Not swallow, but chew. If you have access to a regular strength aspirin and you're not allergic to it or taking blood thinners that would make it dangerous, this single step can significantly improve your chances of survival. Aspirin works by thinning your blood, which helps prevent the blood clot that's likely causing your heart attack from getting bigger. By chewing the tablet instead of swallowing it whole, the medication enters your bloodstream faster. Medical studies have shown this can buy you valuable minutes, sometimes even restoring some blood flow before emergency help arrives. Let me share the story of William, a 74-year-old retired teacher. When he felt that familiar chest pressure spreading to his left arm, he remembered reading about aspirin and heart attacks. He chewed one tablet while sitting at his kitchen table waiting for the ambulance. Later, his cardiologist told him that simple action likely prevented additional damage to his heart muscle. That little pill, the doctor explained, helped keep things from getting much worse. If you live alone, make sure aspirin is easily accessible. Keep some in your nightstand, kitchen drawer, or even your wallet. Check expiration dates regularly and make sure family members know where you keep it. This isn't just a helpful suggestion. It's a scientifically proven intervention that emergency responders use worldwide. However, don't take aspirin if you're allergic to it or if you're on prescription blood thinners without consulting your doctor first. If you're unsure about whether you should take aspirin, discuss this with your physician before an emergency happens. Once you've called for help and taken aspirin if appropriate, your next job is deceptively simple but absolutely crucial. Stop moving and find a comfortable place to sit or lie down. This isn't the time to tidy up, gather your belongings, or try to make yourself presentable. Any additional physical activity puts extra strain on your heart, which is already struggling. The best position is sitting upright with your back supported, feet flat on the floor, and arms resting comfortably. This position helps reduce your heart's workload while you wait for medical help. If you feel faint or dizzy, lie down on your side with your head slightly elevated. Don't try to push through the discomfort or maintain your normal activity level. Many people feel embarrassed about calling for help and then just sitting there doing nothing, but understand this. Doing nothing is actually doing something very important. You're giving your heart a chance to stabilize, allowing your breathing to slow down, and conserving your body's limited oxygen supply. Consider the experience of Pearl, an 81-year-old woman who felt chest pressure while washing dishes. Her instinct was to finish cleaning the kitchen and put everything away before the paramedics arrived. But she remembered her doctor's advice. If you think it's your heart, sit down immediately and let everything else wait. She settled into her favorite chair and stayed still. That decision, she later learned, likely prevented her symptoms from escalating into full cardiac arrest. If you're sitting without back support, don't let your body slump forward. Keep your spine reasonably straight and your breathing passages open. The more relaxed and supported your position, the less effort your heart has to make to keep you stable. If you still have enough strength after settling down, consider unlocking your front door. This might seem like a minor detail, but in an emergency, even seconds matter. A locked door can delay treatment when every moment counts. Paramedics are trained to break in if necessary, but forced entry takes time, causes property damage, and might even startle you if you're near the entrance. Unlocking the door lets them walk right in and begin treatment immediately. This simple action could save several precious minutes. If you live alone, especially in an apartment building or gated community, think through these logistics before a crisis happens. Is your address clearly visible from the street? Do you have a spare key that a trusted neighbor can access? These preparations might seem unnecessary until suddenly they become critical. Consider the case of William, a 76-year-old man living in a small condominium. When his heart attack symptoms began, he managed to call 911, take aspirin, and unlock his door all within 2 minutes. The paramedics later told him that unlocking the door helped them reach him 30 seconds faster and saved them from having to break in. "That's the last thing I would have thought of," he said later, "but it might have been what got me help just in time." If walking to the door feels too risky or you're too weak, don't attempt it. Your safety is more important than convenience. Focus on staying calm and conserving your energy. But if you're close to the door and feel steady enough to reach it safely, that unlocked door could be the difference between immediate help and dangerous delays. Your smartphone becomes a lifeline during a heart attack, and there are specific ways to use it that can improve your chances of survival. First, switch to speakerphone when talking to emergency dispatchers. This allows you to communicate hands-free, reducing physical strain and letting you focus on breathing and staying calm. Using speakerphone also allows the dispatcher to hear you more clearly and pick up audio cues about your condition. They can hear changes in your breathing, detect if you're becoming weaker, and even listen for sounds that might indicate you've lost consciousness. This information helps them guide the paramedics and prepare them for what they'll find when they arrive. Every smartphone now has an emergency medical ID feature that could save your life if you become unconscious. On iPhones, this information is accessible even from the lock screen. Android phones have similar features. This digital information includes your age, medical conditions, medications, allergies, and emergency contacts. Think about what happened to Betty, a 79-year-old woman who collapsed just before paramedics arrived. Because her phone contained her medical ID information, the emergency team immediately knew she was diabetic and allergic to penicillin. This prevented them from giving her medications that could have made her condition worse, and they were able to contact her son using the emergency number listed in her phone. Setting up your medical ID takes less than 5 minutes and lasts indefinitely. Include your name, birth date, major medical conditions, current medications, known allergies, and at least one emergency contact. This isn't just for tech-savvy people. It's for anyone who might need help when they can't speak for themselves. The final tool you have during a heart attack is also the most basic: your breath. When panic starts taking over, controlled breathing can help calm your nervous system just enough to give your heart a better chance at staying stable. Controlled breathing won't cure your heart attack, but it can prevent your body from going into full shock while help is on the way. The more anxious you become, the faster your heart beats, but slowing your breathing can gently bring that rhythm back down. You don't need complicated breathing techniques. Try this simple approach. Breathe in slowly through your nose for about 4 seconds. Hold it briefly, then exhale gently through your mouth for 6 seconds. Repeat this pattern, focusing on that steady rhythm. It gives your mind something to anchor to and can help prevent dangerous heart rhythms triggered by extreme stress. Richard, an 83-year-old retired mechanic, remembered this technique when chest pain struck him at home. He felt like he was drowning in fear, but he focused on slow, deliberate breathing while waiting for help. By the time paramedics arrived, his heart was still in distress, but not in full arrest. "I just kept thinking, stay calm, stay alive," he said later. You can practice this breathing technique anytime when you're relaxed, watching television, or feeling mildly anxious. The more familiar it becomes, the more instinctively your body will return to it when stakes are high. Your breath won't repair blocked arteries, but it can buy you time. Keep oxygen flowing and help your heart maintain some stability until professional help takes over. Surviving a heart attack alone isn't about luck. It's about preparation, awareness, and calm action. These 7 steps form a powerful chain of survival. Recognize the warning signs early, call for help immediately, chew aspirin if you can safely do so, minimize physical strain by sitting or lying down, make it easier for help to reach you, use your phone's emergency features wisely, and control your breathing to stay as stable as possible. Each of these actions buys you precious time. Each one gives you more control over the situation. Most importantly, each one proves that even when you're alone, you're not powerless. Heart attacks can feel terrifying and isolating, but with the right knowledge and preparation, you have tools to fight back. Think about which of these steps stood out most to you today. Was there something you hadn't considered before? Review and act on how you can prepare yourself. It might not just save your life, it could save others as well. Remember, the key to survival is acting quickly and staying as calm as possible. Every second counts, but you now have a plan. You have knowledge. You have the power to take control when it matters most. Thanks for watching the Dr. Forever Healthy channel. We would love to hear about your journey to health as you age, so please leave a comment in the section below, then subscribe to this channel.